I think if we take a broader look at biomarkers testing and then think about the situation in the UK, there are some general issues that everyone has, and then there are possibly some more specific issues in terms of the situation in the UK. I think from what we've seen at this meeting and at other meetings, there are simply more and more molecular events or molecular biomarkers that are or may become required for treatment decisions to be made. And it becomes more and more of a challenge to deliver all of this stuff when the materials that we have to work with are still the same, often quite modest or tiny tissue biopsies. So one solution to this is to use your tissue biopsy in a smarter fashion, but the other interesting development, of course, is the use of blood as an alternative source of tumor-derived nucleotides, particularly DNA. And the blood test is brilliant for some things. It's not so good for some other molecular alterations. So my feeling is that as we go forward, we're going to have to develop strategies on how to learn to use blood and tissue testing in combination, because there's lots of evidence for particular markers that blood is not a particularly good moiety to work with in that regard. So a combination is going to be required. This is going to have quite significant impacts on laboratories' workload, and it's going to have significant resource and money implications. But we have to work towards it, and as Ali Greystoke said this morning, we need to embrace it and get on with it and not complain. And I think that's absolutely right. That, I mean, it is the way forward. We're slightly in a situation where we have the technology, but we haven't quite figured out what to do with all the data that we get from that technology. To some extent, I think we'll get there, but it's going to be tough, because a lot of the investigations and a lot of the studies will refine patients into smaller and smaller and smaller subgroups, where we might almost get to the point of n equals 1, because every patient will have a almost unique molecular profile. So how are you going to know what to do? How can you test what's the best thing to do for that patient? And that's going to be a real challenge, I think.